talk about breastfeeding a newborn. There are two positions that are offered in the hospital if you are being instructed by nurses or lactation consultant. The first of which is called the football hold. This is usually done for people with larger breasts, if you have a C-section, or if you're just kind of struggling to latch because you can see your breast and baby's face a little bit better. And I will show you. Here's our baby. Ideally, you'll have some sort of pillow to support you. It's very important to be comfortable when breastfeeding. You'll put baby along the side. You want to make sure that they are wrapped all the way around your back and that their breast head and nose is directly next to your breast. The next important thing to know is if you push baby's head, they will push back and that will interrupt the flow of breastfeeding. So you want to kind of cradle your hand around their neck and ears to support their head. So with this position, you're going to have them wrapped all the way around. You're going to use your opposite hand to hold the breast and move it to baby. Like that. The next most common position that's offered in the hospital is called cross cradle. So what you'll do is you'll take baby across your chest, ideally with a pillow again. You're going to use your right hand to kind of cup baby and again hold their head gently like you do with a football hold around their neck, behind their ears. And then this time you're going to take your other hand and hold your breast this way and latch them on. Ideally with a newborn baby, you're not going to really let go of either hold because they cannot hold their heads up. Once they get really settled, you may be able to hold them like this as long as you're able to jump back on to relatch them if necessary. So the next one is laid back. This is a really great position for someone with a very fast milk flow, large breasts, or a C-section. The laid back position is where you'll have baby laying directly on top of you. You want to make sure that you're supported on a couch or a bed or a chair and you are mostly reclined and comfortable. And then you're going to have baby lay directly on your chest like they're doing tummy time, and you can latch them just like this. And back and relax. This is really great again for fast milk flow because the gravity is not forcing the milk flow to come even faster. It's also great for large breasts because again there's not so much tissue being held down by gravity, and it's also good for C-sections because there's no pressure on the scar. And the last one is called side lying, which I personally would never do on a couch. It's something that you would do in a bed, but again, it's really great for fast letdowns, for large breasts, and for C-sections. But this is where you would lay down next to your baby in bed. So what you would do is you would lay down baby, make sure they are directly laid down next to your body, nose to breast, and then you would latch them on. And you would lay like this and support them and hold them. Again, you want to make sure that you are staying awake and staying safe. The most important thing to remember about all of these positions is something called having baby belly to belly. The idea is that baby's belly, no matter which position, whether you're here, lying down on your back, or lying down on your side, the baby's belly is always touching your belly or your body. And the idea is if you think about yourself as an adult, if you are eating a big meal and you're turning your head when you're chewing and swallowing, it's much harder to swallow and chew than if you're looking head on. It's also much easier for a new baby to latch on to the breast when they're focused head on and their body's aligned. It initiates pressure points and responses from their whole body to latch on correctly. Thank you so much for watching.